Hello everybody, my name is Lisa Shesterkin and I am a student, a mother, a wife, and a co-worker. I currently work as a nurse with the orthopedic surgery team, and I received my associate degree of nursing through Schoolcraft College in 2013, and I am currently working on my Bachelor of Nursing through Notre Dame College. One unique thing, as I said, I worked for the orthopedic surgery team, and instruments that we use on a daily basis are very similar to ones that one may have in their own garage. My presentation is on art therapy, classical music, and their effects on the psyche. Studies have shown that art therapy have positive effects on people with mental illnesses. Positive affirmations are statements that one feels describes their positive attributes. And it is said that if you say these positive attributes out loud, you will believe them about yourself. Classical music has been studied to prove that it will help relax your mind and help you absorb new information. The project that we worked on were helping in testing these rationales. What we were testing is that if people who might not be in their normal mindset could give thought to their own positive affirmations, and this would challenge their ability, or I should say, in turn, we are challenging their ability to listen to classical music while they're working on this project, being that perhaps they might not use or listen to classical music on their own choosings. On our projects, we had some pre-drawn trees, and on these trees, on the top it said, I am, and on the bottom it said, if I believe in myself, all things are possible. And what we had them do is, these trees had leaves of different colors, or we had different colors, leaves available with positive affirmations, and they were to select the leaves which they thought reflected how they felt about themselves, and they would glue the leaves onto the trees. And in turn, if they selected the words and they read the words, then they would believe that about themselves. Art therapy began in the early 1940s. It was thought to test the emotions, and their rationale was that images and color would help reflect on a patient's subconscious state. It was also felt that when testing patients in art therapy, that perhaps that should be tested over a few weeks or even a few months, that they would keep this art journal. In art therapy, it is thought that it would help reduce their heart rate and also decrease their stress. Now, the day that we presented this project, the activity level was very heightened. We thought perhaps these clients would be more beneficial to have an activity, full of activity, where they could run and shout, versus listening to classical music and having an art project. However, we decided to go along with the project and see if it would in turn result in a more relaxed state for everybody. Interestingly enough, patients worked together on their art projects. There were even a group of people at another table who were playing cards, and they stopped playing cards and they came over and they worked on their project also, and they also worked to help each other finish their project. While they were working on the art project, we had Vivaldi playing. The Vivaldi piece we selected were Four Seasons, and we selected Four Seasons because it is said to have a very soothing rhythmic tone. Along with these Vivaldi pieces of music, Monet had worked with him, or it is said that some images that Monet had drawn or painted worked along with the Four Seasons. They kind of reflected the different music. So we also had the clients look at these images and tell us what they felt about them. Overall, when they were all done, surprising to us, they asked if they could present their self-affirmation pictures to the rest of the people in the room, which we proceeded to work on that. So ultimately, the project was a success, even on a day when activity seemed like it wasn't going as well. And we were all glad that we did proceed with the project as planned. Thank you.